All right, I guess we will get started. First, that wakes everybody up. Anybody snoozing there? So thank you for joining us. This is one more in a series of great lunch and learns, and I'm really excited to introduce someone. Not so much because it's yet another doctor, but because Dr. Christopher Lisi brings along a great level of experience and leadership in helping us develop our new program in ENT and head and neck. And real quick, Christopher graduated from Drexel Medical School and went to Villanova undergrad, grew up on Long Island, so he's a local guy, has a tremendous career ahead of him that he's going to make Richmond University Medical Center his home. Really well trained. The other thing that I'm really excited about is he does both adult and child. So with all the allergies and ENT issues and all those great things that challenge young moms and families, and certainly people as they age, we really have a tremendous leader here now. We've had a little bit of a gap over the last several years in this field, and this really brings and fills a huge opportunity for us. So lots going on. I'm not going to talk too much, but I just wanted to say, Christopher comes on board with a whole list of new docs that have been coming to Richmond University Medical Center. Dr. Barkin, who you may have met, who's our chief of bariatric surgery, weight loss surgery. Also a minimally invasive general surgeon, does some terrific general surgery work for us, robotically trained, comes from the NYU Winthrop system. We recently brought on board Dr. Wilson, who is a fellowship-trained breast surgeon, leading the breast surgery division, and our wonderful Breast and Women's Center on the corner of Victory Boulevard and Clove Road. If you haven't seen it, you don't have to go there for a mammogram, but you could. I hope you do if you need to, and you should, obviously. But I would love for you guys just to see it and drop by there someday and just take a walk around, and you can mention Dan Messina, the president and CEO, said, you know what, we should stop by and see this beautiful facility. It's really a beautiful facility, mahogany and marble floors. We really, this is a special program for a very important population to a hospital, connected to a hospital. So we're really excited about that. And then you look, across the spectrum of other specialties, including oncology, Dr. Shimolovich, recently partnering with Dr. Falenza, and the list goes on. So we really are in a major building mode today, and we're really working closely with the terrific medical staff that has been here for years and kind of melding the two to really take us ahead going forward. The emergency department, we've had fits and starts because of random paperwork that, through random audits within the building department, but that is moving along. You should be seeing that really take off again. So we're really excited about that. I'm happy to see lots of work on the parking lot. And actually, one of my local neighbors just came up to me before I got up here on the stage and complimented the hospital. We really appreciate what the hospital is doing with respect to a new parking lot. We have spent and really gone out of our way to do what we need to do as good neighbors, and that's important to this hospital. That's the DNA of Richmond University Medical Center. We are the community. We're not a hospital abroad that's coming in. We've been here for 115 years. Our relationship with our community, with our neighbors, is critical. And we're really happy that you'll see a beautiful new parking lot that is going to be very respectful of the local neighborhood. We've actually recessed the parking lot. We've put in, and soon to be more, several $100,000 worth of landscaping to shield the parking lot, lowering the future lampposts so that we don't shine into our neighbors' homes, and really going out of our way. So if you look out my window where I see the parking lot, you'll see like not a single parking spot in that parking lot right now. And that just tells you how badly we needed more parking. And we've been all around the community parking in front of everyone's houses. And I'm sure a little bit of that will remain. But when we add 240 new parking spots over the next few short months, it's going to be a really, I think, important thing for the hospital as well as the neighbors. So I am going to stop here. Appreciate your support. Again, just going back to that emergency room, we're looking at about an 18-month project. That will be a spectacular state-of-the-art facility that will actually be moved upwards closer to Castleton Avenue. So the entrance will not be buried all the way in the back there. It'll be brought all the way up. It'll be a new facility with a second floor that will be the future home of all of our new operating rooms and new peri-op space, as well as the expansion and renovation of critical care. So lots of good things happening, and so I will stop here and I will introduce a terrific addition to the team, Dr. Christopher Lisi.
Thank you very much, Dr. Messina. I'm Dr. Lisi, the new head of the ENT division here at the Medical Center and the Richmond Health Network as well. I really want to thank you, Dr. Messina, for introducing me, and the RUMC leadership has been very, very supportive in getting this ENT. People often have to go elsewhere for their care over the past several years, and as Dr. Messina said, there's been a little bit of gap in that, and we're trying to bring that back to this area of Staten Island and really serve the community. So I'm very excited. The leadership of the hospital has been very, very supportive, and we've only been building this program since late October, early November, so it's very, very recent, and we're very, very excited to do big things. So as Dr. Messina said, I also do pediatric and adult ENT. Can everyone hear me okay in the back? Speakers are good? Okay. I have no disclosures for this presentation. A little bit about me. I am local. I grew up on Long Island. I'm board certified in ENT from the American Academy of Otolaryngology. That's the fancy word for ear, nose, and throat. I can't pronounce it half the time, so I don't try to. I did a 5-year residency in ENT and a chief residency, and I did my training in Miami, Florida, where it was a little bit warmer, but I'm very happy to be back locally. I've been in private practice on Long Island, actually, the past several years, and I decided to transition here to build this program. So my philosophy is I really try to focus on quality of life. ENT and ear, nose, and throat is a very quality of life oriented field. I'm dealing with the senses of smell, taste, hearing, and people's voices. And when I'm dealing with the face, head, and neck, this is such a sensitive anatomical site. This is really how we present ourselves to the world and to each other. So people are always very concerned about how is this going to affect me, and will there be a scar, or will I get my hearing back? Things like that. And I really try to focus on these quality of life issues in order to improve patients' lives and how they interact with people. And recently, over the past 10 years or so with ENT, there's been so many technological advances that we're able to do we're able to use a lot of new medicines, and we're able to use a lot of new procedures, a lot of which can be done in the office to restore things like voice for chronic hoarseness and vocal cord paralysis, or improve hearing, or treat chronic sinus infections, sometimes without even stepping into an operating room, which we used to do a fair amount in the past decades. And that's what I'd like to focus on a little bit today. So we'll talk a little bit about chronic sinus issues, which probably have impacted all of us at some point in our lives, and how we can help alleviate those conditions. So here's just a map of my office. You can see it's the big red circle in the middle. We're located on Richmond Avenue near Z1 Diner. Everyone seems to know where that is, so I use that as a landmark. Just a few minutes north of the Staten Island Mall, and the red circle on the top is where we are now at the hospital. So just a short drive. So some of the services we offer, just so you know what an ENT office can offer, everything from airway surgery to sinus and allergy treatment. We do plenty of head and neck cancer diagnosis and treatment, so diagnosing and biopsying neck masses or oral cancers or suspicious spots inside the mouth or throat or sinuses. We take care of all of that. We take care of all these issues in pediatric patients too. So I see everyone in my office from infancy up to 100 years old, and I see the full gamut of age groups. And we take care of all those common things in pediatric populations as well, like tonsils and adenoids, and removing tonsils and adenoids, and ear tubes for chronic infections, etc. What I really want to highlight is, again, the ability to do minimally invasive office procedures these days, which didn't exist almost 10, 12 years ago. And a lot of times we're able to avoid anesthesia, avoid an operating room for lots of different things, and we'll talk a little bit about that. So how prevalent is sinusitis? Well, we think it actually affects about 30 million Americans a year. By some studies, it may be actually more prevalent than heart disease, affecting 1 out of every eight adults. This is a very high cost burden in the United States, missed days of work, missed days of school, and almost 1.2 million hospital or doctor's visits a year, probably more, for sinus-related issues. Again, this is back to quality of life. This really can impact quality of life if you can't breathe through your nose, if you're chronically congested, if you don't respond to a course of antibiotics given by an urgent care or primary care center. I think this is where an ear, nose, and throat office, an ear, nose, and throat surgeon can really come into play. And the way we do that is by an office endoscopy. What we can do is insert a small, thin camera into the nose and into the sinuses to see, are you really suffering from a sinus infection? Is it something else? We can also directly visualize the throat and the voice box to see if there's different disorders going on there. And this is done quickly, safely, and very comfortably in the office with a little bit of local anesthesia maybe, and no sedation or general anesthesia at all. So we know what we're talking about anatomically here. On your left side here is what normal sinuses look like. I don't know if you can see my mouse. So this left side of the image, you have normal healthy sinuses. Okay, these are the air spaces, the hollow air spaces in your face, around your eyes, under your eyes, between your eyes. And when these get inflamed, and you can see it, the other picture, I'm not sure if it's coming out too well there, but you can see the sinuses, when they are inflamed, can fill up with pus. They fill up with fluid and they drain. And sometimes this is associated with a cold or something like that. It may last a week, may last 10 days, may get better on its own, but may require a course of antibiotics. Most people get better from a sinus infection within 10 days, but there is a subset of people where it goes on for weeks, sometimes months. They don't respond to antibiotics. They don't respond to nasal steroid sprays like Flonase, and other common medicines like allergy medications. What causes sinus infections? Well, again, it can start with an initial cold, or it could be a cold that ends up turning into a sinus infection. But also allergies have a big role here. People who suffer from chronic allergies, either seasonal allergies or year-round indoor allergies. This causes chronic inflammation and swelling of the lining of the sinuses. And what happens then is fluid backs up into these hollow air spaces in your face. You can feel pressure, discomfort, drainage, and again, allergy medications can be effective, but not all people respond to these things. So there are a couple of important types of sinusitis for our purposes to recognize, and I kind of mentioned these. There's the acute rhinosinusitis, which lasts maybe 10 days, lasts maybe a week, something like that, and usually responds to treatment. Then we have acute recurrent sinus infections, which are these short-term sinus infections that keep occurring throughout the year. Maybe happens 4 or 5 times a year. It lasts a little bit longer than a cold. You get pressure in your face, but these don't typically respond to antibiotics as well as a cold might. You may need a second week of antibiotics, sometimes a third week, and then it will resolve. If this keeps happening throughout the year, we call this recurrent sinusitis, because you get periods of relief in between, but it keeps happening, and you have to go on lots of courses of antibiotics, so you keep needing to take medicines for this. This is also something very treatable. And then chronic sinusitis is when you get a sinus infection and it just doesn't clear up. You've been on medicines, antibiotics, things like Flonase, and despite all of that, your sinus infection persists. This is when your primary doctor or an urgent care can refer you to an ENT, and it would be, I think in most cases, very beneficial. So people come into my office all the time complaining of sinus issues, but complaining of headache as well. So I think this is important to mention because a lot of these symptoms can actually be differentiated. Despite, I think, popular and what's I think considered common knowledge, sinus infections and sinusitis don't usually cause headaches. I think people and hear from other people or primary doctors that have been told their whole life that they have sinus issues when actually they have headaches. This is something very important to distinguish between, because if we keep treating headaches with antibiotics or sinus medicines, your problem's not going to get better. Very good idea to come into the ENT for these issues if you think you suffer from chronic sinus related headaches, because again, this is where we can look in the nose directly and see, is this actually a sinus infection? Are you suffering from something other than that, such as headaches? And an endoscope or an endoscopy in the office to look in the sinuses can be very, very helpful here. But here are the main symptoms of sinus infection. Facial pain or pressure, not full-blown headaches on the top of your head or in the back of your head or on the sides. This is not usually the sinuses, but pain in your face, pressure directly in the face, around the eyes, under the eyes. This is a very common symptom. Discolored drainage coming from the nose. We sometimes hear that yellow or green doesn't always mean infection. That's true. That's true. Mucus can just sit in your nose and become a different color, and it's not necessarily an infection, but it certainly could be in chronic sinusitis. So that's another major symptom. If you're very stuffy, very congested, not being able to breathe well through your nose, this is one of the diagnostic criteria for a chronic sinus infection. Most people that have chronic sinus issues cannot breathe very well through their nose. And sometimes you don't even know you can't breathe well through your nose. It's been such a chronic issue for so long, you're just used to it. But this is where, again, an in-office evaluation can really, really help, because we can, again, stick a camera in there and really look. How congested are the sinuses? Do you have adequate air passages for breathing, etc.? And oftentimes a decreased sense of smell. I always tell people, if you're not smelling well, if you have a decreased sense of smell, you should get evaluated by an ENT. Most commonly, it's related to sinus or allergy issue, but it could be other things. It could be nasal polyps, big inflammatory kind of water balloon looking things that can grow inside the sinuses, which is usually due to allergies or chronic inflammation. These can block the sense of smell. Also, rare things can cause issues with the sense of smell. Tumors growing in the sinuses, rarely brain tumors, things like this can affect the smell nerves or block the sinus passages and affect the sense of smell. This is something that's very hard for an urgent care or primary doctor to evaluate, and an ENT office is well equipped to look directly in these areas. Further testing may include a CAT scanner or things like that, but always looking at it in the office with the camera is a quick and effective way of evaluating things. So how do we treat chronic sinusitis, people with chronic sinus issues? So another thing I want to differentiate is the difference between just being stuffy and congested or actually having sinus infections. So sometimes it's very hard for patients to tell the difference, which we are able to distinguish between in the office. So again, if you don't respond to things like a long course of nasal steroid spray, Flonase, Nasonex, Nasacort, things like that, come in for an evaluation. So people may not require long-term medicine, so we may be able to control sinus symptoms and nasal congestion with just environmental or lifestyle modification. So this includes everything from stopping smoking to allergy avoidance or allergy testing to see if you're allergic to anything, to using other medications and doing medical management. Now, one thing I do really want to mention is smoking. So I will see a lot of smokers that come into the office and they have chronic sinus issues, chronic sinus infections. This is for a very important reason that's well known to the medical community, but people may not put it together necessarily in their own head, is that smoke and the toxins in smoke, which directly get inhaled into the sinuses, actually affect the cilia. The cilia are the hair cells which line the linings of the sinuses, and they act like a little broom, a little sweeper, and it sweeps out mucus out of your sinus passages, down your out of your nasal passages, so you can either blow it out or it goes down the back of your throat and you swallow it. basically smoking, cigarette smoke, vaping, anything like that paralyzes the little cilia, paralyzes the hair cells so that mucus cannot be cleared, which leads to chronic inflammation, bacteria overgrowth in the sinuses, and chronic sinus infection. So this is a very important relationship to understand. Medically, what we can do is antibiotics. We can do nasal steroids. Sometimes somebody with a bad sinusitis may require a dose of oral steroids to help quell systemic inflammation, which can be helpful sometimes. Allergy medications include things like antihistamines, Allegra, Claritin, Zyrtec, any of these over-the-counter antihistamines that you've probably used before. Something that I very much like to use in my patients that is a prescription that cannot be used over-the-counter is actually antihistamine nasal sprays. Instead of taking an antihistamine pill, you can deliver it directly to your nose, and I can tell you if you would be a good candidate for something like that, and it helps many, many people. Something big too is I'm sure people have heard or you may be familiar with something called the neti pot, which is this little kind of tea kettle looking thing that you can buy over the counter in the pharmacy. And what this does is it has a little spout, and you pour it into your nostril, lean over the sink, and let the mucus and the water flow out the other nostril. This is super, super effective in removing mucus, removing allergens, and all the things that cause inflammation from the nasal passages. I have my sinus patients do this routinely, sometimes multiple times a day, and it's highly effective. Doesn't cure every case, but it certainly can help. And my post-procedure or post-op sinus patients are doing a very routine regimen of rinsing their nasal passages to promote mucus clearance and promote healing of the sinuses after a procedure. And people are hesitant at first, or can be hesitant, but they love it afterwards. It helps you breathe better. I use it myself, and I think that it really works well. So it's something to think about. And what do we do if all this stuff doesn't work? Well, we have sinus procedures. The only thing we used to be able to do is surgical types of procedures, fixing a deviated septum so that your nasal passages are more open, reducing the turbinates. What are the turbinates? These are chunks of bone and tissue that grow in the nose that are normal, but they can be overgrown in certain people, and these can be reduced in size, usually with the surgical procedure. And then we do something called endoscopic sinus surgery, which has really been an advance over the past 25 years in sinus surgery, where we can go minimally invasively through the nose with a camera, usually under anesthesia, and clear out the sinus passages and open the sinuses without any cuts on the face or any scars or anything like that. That is highly effective, but those types of procedures usually require you to go into the operating room under general anesthesia. Now, though, over the past, I would say 10 to 12 years, we're converting a lot of those procedures that used to be done in the operating room to office procedures under minimal sedation and just local anesthesia. We're realizing that it's very well tolerated, and for select patients that either can't go to the operating room under anesthesia, aren't healthy enough, or have other medical conditions, they can be done right there in the office. We can even do things like correct some deviated septums and things like that in the office. In certain patients, not everyone is a great candidate for that, but it's if you think you might need something like that, it's great to have an evaluation, because we may be able to save you a trip to the operating room and save anesthesia. It just makes everyone happier. So I'm going to skip ahead a little bit. This is what I was just talking about. This is something called endoscopic sinus surgery. And if you can look at the picture there, your picture on the left is a picture of sinuses basically filled with pus. Okay, you have inflammation of the lining of the sinuses, which are this red lining all around the sinuses, and you have this yellow pus filling up the sinus cavities. Afterwards, the picture on the right is what it may look like cleared out after an endoscopic sinus surgery or even an in-office procedure. We remove all the inflamed areas of the sinuses and remove kind of chunks of bone and things that are blocking the sinus drainage pathways. And really what this allows us to do is to physically go in there, remove the mucus and remove the diseased areas of the sinuses. Also, really it allows us to open the drainage pathways so air can go in and fluid can flow out, okay? The third benefit of that is now your nose is a lot more open for medicine delivery. So sinus rinses, with the things like the neti pot become a lot more effective because the sinus passages are more open. We can even put anti-inflammatory and antibiotic medicines directly into sinus rinses now instead of having to constantly take oral antibiotics. And if you're on a nasal steroid spray like Flonase or Nasonex, now there's a much bigger area and a much more open area for these medicines to get delivered directly to the areas that were inflamed. So it kind of has this surgery or sinus procedures kind of has a threefold effect. So in terms of the evolution of what we're able to do for the sinuses and for the nose over the course of time, this is a list of some of the advances. All the way on your left, this is the beginning of time, which is, I would say, in the early 1990s, they invented something called the endoscope, which is a fiber optic camera for looking in the nose. It's also the same thing that you are familiar with when you get a colonoscopy or an upper endoscopy from the GI doctor. In ENT, of course, they're way smaller. They fit in way smaller passages. But this is the same type of technology. It's a fiber optic light with a high definition camera on the end of it that can look in all these places with a very high definition quality image. And you should know the image quality over the past 3 to 4 years has become extremely HD. Like your nice HD TV at home, we can now see that, get an image of your sinuses, image of your vocal cords with that quality. It's really fantastic. The last 10 years, we've seen something called surgical image guidance develop. And this is when we're able to do sinus surgery and sinus procedures directly in the office with something that's basically surgical GPS. So this is done with, after obtaining a CAT scan of the sinuses, we can basically track where we are in the sinuses during a procedure with our instruments, and we can track the exact location of everything at any given moment of time, which makes sinus surgery a lot safer and a lot more effective because we're able to open these areas that are sometimes inaccessible if you're not using this surgical navigation or GPS type of system. And this is actually an image of that. You can see this is all up on a screen in an office or in an operating room, and we look at both the CAT scan at the same time and the endoscopic view with the camera, all combined into one image, and we match them up, and it's really beautiful. So a little bit back to the advances in technology. Over the past 5 to 7 years, I would say, with the advent of office procedures for the sinuses, we now do something called balloon sinus dilation, or what you might have heard referred to as balloon sinuplasty, where instead of removing the inflamed areas of the sinus passages and removing kind of like chunks of bone and tissue that are blocking these drainage pathways, we can now dilate them directly, kind of like cardiologists are able to dilate and perform angioplasties on blocked coronary arteries. So this is a similar concept. A very small catheter is inserted for let's compare this to heart disease. A very small catheter would be inserted right into the artery of the groin and up to the heart. And on the end of this catheter is a very small balloon, which can be inflated. And what that does is expands these blocked arteries that are blocked by cholesterol and plaques. Right now we can do the same thing for the sinuses. We insert a very small balloon catheter into the nose and into the blocked sinus passages, insert a balloon, inflate the balloon, and now dilate these formerly blocked passages. This is very effective for many people. And can often, like I said before, often save a trip to the operating room. The balloon is then deflated and removed from the sinus passages, and now the sinuses are able to breathe on the inside and mucus is able to flow out. So highly effective and very well tolerated in the office in most patients. And I would say that the latest advance in sinus procedures is something called a steroid-eluting stent. What is that exactly? So similar concept that I think was borrowed from cardiology is when cardiologists put stents in the coronary arteries to keep a blockage open, we can do the same thing for the sinuses. And what's great is you don't have to be on blood thinners like you are for those types of heart procedures. So into these blocked sinus passages, after we dilate them or open the passages, in order to keep them open, we can put a dissolvable steroid-eluting stent directly into the sinus passage, so when the sinus passage heals, it does not scar down and close off again. The sinus passage will remain open to get much longer-term relief. Not only does this stent act like a spring and keep the sinuses open, but it also is coated in a steroid, an anti-inflammatory, which does not get absorbed into the body, so there's not systemic side effects from it. And two, it delivers a very high dose of it to the surrounding tissues, so that when the tissues heal, they heal with less inflammation and less scarring, so that a revision procedure or repeat sinus infections are much less likely. And you can see it. You can see this procedure right here. This is the in-office balloon dilation, and the image all the way on the left here is a picture of an inflamed sinus. This is the frontal sinus, which is the one above the eye, and you can see the lining of the sinus is inflamed. There's this yellow pus in the sinus. So what's done is a balloon catheter is inserted into this tiny, tiny hole where the blocked sinus is causing problems. And then over the catheter, over the guide wire, a very thin balloon is inserted and expanded, and this applies enough pressure to open up the passages and the disease areas. What's also beautiful about this technology is that right through the catheter, we can also flush saline irrigation and antibiotics and things like that to clean out the sinuses right there on the spot. And the image all the way on the left, all the way on the right in step 4, you can see now this is an image of a cleared sinus passage, and this would the goal here is to allow this to aerate, mucus to drain, and for the sinus passages to heal over time. Here's kind of a cartoon version of the same exact procedure, and looking at one of the openings of the sinuses, and all the way on the left here on step number 1, this white thing is the balloon catheter being inserted. The balloon is expanded, and then we remove that, and it's not very easy to see up here, but this little steroid-eluting stent, which kind of looks like a mesh and kind of has a spring action, is inserted right into that sinus passage, okay? This dissolves over time, and the end result is all the way on the right in step 4. This stent dissolves and creates an anti-inflammatory effect and leaves a nice, well-healed, open sinus passage. And this is a new technology within the past 3 to 5 years, I would say. Since I've made this presentation, there's even a newer technology that came out for people with nasal polyps. Nasal polyps used to be a big nuisance. I like to think about nasal polyps as basically asthma of the sinus passages. You can't really ever get rid of asthma. Once you have it, you have it, but we can control it, right? So that's basically what polyps are inside, or chronic sinusitis too, is inside the nose. It's a chronic disease of the lining of the nose. It's similar to asthma. It may never fully go away, but we can control it with medicines. And now, people with polyps that used to block their sinus passages, block their breathing, all this type of horrible quality of life issues, those people would often need to come in for procedures like every few months or multiple times a year to have polyps removed. Now there is this nice, beautiful little plastic implant that can be inserted high up inside the sinuses, right in the office. It's removable, and it sits there for about 2 or 3 months, and just slowly elutes steroid off of it. And the polyps are very, very steroid responsive, meaning the polyps just melt away with any anti-inflammatory steroid in the area, and this delivers the drug right to the area of inflammation, right to the area of polyp in the sinuses, and it's highly, highly effective. That's so new I don't even have a picture of it. They've done some short-term studies on that so far and had great quality of life outcomes. It really reduces the number of procedures needed, reduces the number of antibiotics and oral steroids that need to be given for these chronic sinus conditions. Interestingly, we're now learning over the past several years that some medications that work for asthma also work for chronic sinus infections and nasal polyps. And a big family of those medicines are monoclonal antibodies. What is that exactly? Well, these are a very expensive immune system modulating drugs that are made in laboratories, and they are FDA approved for people with refractory asthma, or asthma basically that doesn't respond well to conventional therapy, and it's usually given as an injection every so often, every several weeks, every few months, something like that. And we're realizing these medicines are also can be very effective for certain people with sinusitis and nasal polyps. So a lot of advances in technology. I do want to leave some time for question and answer, and we can talk about anything ENT related, not just sinuses or allergies. But I do really want to hit on the fact that the management of sinus infections and chronic sinusitis is not just usually a one and done type of thing. As you can see, it's really a puzzle requiring input of multiple different, sometimes different specialists, allergists, immunologists, ENT surgeons, and really different factors. So the lifestyle modification like allergy avoidance and even controlling asthma, medical management, and things like endoscopic sinus surgery and office procedures. Oftentimes these things need to be used in combination, and there's multiple ways of attacking this problem. And just over the years, we've really improved the amount of tools in our arsenal for conditions like this. So at this time, I just kind of want to leave it open to questions or any comments or concerns, and I'll do my best to try to get a conversation going. Yes?
I'd like to add a comment. Our nose directly connects the brain. I'm a neurologist, so I'm Dr. Han.
Hi.
So the olfactory nerve is affecting the mucous membrane of our sinus. It's directly connected, the receptor of the smelling, and it goes to the brain and enters the olfactory nerves. So people are not aware how precious our nose is. So in the Staten Island, infested with the drugs, the cocaine is a sniffing, heroin sniffing. It goes direct to the brain.
Yeah.
It causes stroke.
Yeah.
And so smoking also destroys all the neurons. So we need to emphasize air pollution and cleaning the air, and then not using the drugs. So this big major issues. You are in the end part of treatment, but in the community services, we really have to emphasize the help of treasure our air and protecting the brain, extension of the brain.
Yeah, I think that's a very important connection. Thank you for bringing that up. The sinuses are right next to the brain, obviously, and they are connected to the brain. As my neurology colleague was saying, they are connected to the brain basically with the olfactory nerve. So at the very, very top of the sinuses, I don't have a great picture of this, but at the very top of the sinuses, the nerves, the sense of smell nerves, enter the sinus passages through the bone, a very, very thin bone that separates the roof of the sinuses and where the brain sits. This is where the olfactory nerves come in, and anything that is inhaled into the nose, or any irritant in the nose, can, number one, affect the sense of smell through basically nerve damage, and two, infections that affect the sinuses. It's rare, but they can cross that very thin bone into the brain, and we do see that on occasion, especially in little children. Like a known complication of a bad sinus infection in little children, this is much more common before antibiotics, is a brain abscess. It can spread from, or an eye abscess, it can spread from the sinuses to the eye or sinuses to the brain, absolutely. And I only talked about smoking, but to hit on the neurological point of view, common inhalant drugs, cocaine or other types of inhaled recreational drugs can really not only do damage to the sinuses, it'll harm the olfactory nerves, so the smell nerves, and it can harm the brain. And we know that cocaine inhalation can cause strokes. And the way that happens is it affects the blood vessels that surround the sinuses in the brain, constricts the blood vessels, and blocks blood flow. And you can absolutely have a stroke from inhalation of things like cocaine, and I see it quite often. Yes.
Are you the Richmond Avenue the only person there now? What is the plan, to expand that, or?
That's a great question. Actually, what we've recently done, I'm the only ENT provider, or the only ENT doctor right now at the Richmond Avenue office. But I've been very, very lucky to now work with an ENT specifically trained physician assistant. Her name is Danielle Karupis, and she's wonderful. So we're kind of acting as a team right now to kind of fill the need for all the patients that haven't had quick access to an ENT when they need it. We are planning to add either new doctors or more physician assistants or nurse practitioners in the near future, because we're already getting very, very busy. In terms of other expansion too, what we're also hoping to add in the near future is an allergy component to our practice, meaning hopefully offering full service allergy testing, possibly immunotherapy, which are commonly known as allergy shots, and even a newer advance in technology, sublingual immunotherapy, which is actually can replace allergy shots and be taken directly under the tongue as a long-term allergy treatment. Yes, sir.
Yeah, I don't know if it's sinus related, but somebody who has chronic postnasal drip, it's more of an annoyance. Is there something that could be done for that that's not quite so dramatic as?
Yeah, so that's a great question. I would say that I have several patients a day, maybe 7, 10, or even more, that come in with chronic postnasal drip. This is a great complaint for an ENT office because it can be multiple things, and looking in the nose and throat with a camera can really help distinguish the different causes of this. Postnasal drip can be allergies, and you just feel mucus going down your throat. It can also be a chronic sinus infection you don't even know you have, with mucus just draining down the throat. And yes, there are options. I showed you the full range of options. There are options other than doing dramatic procedures or surgeries, and a lot of these things are less dramatic than I've made them seem. But yes, there are other options. It's not all sinus related though necessarily. Interestingly, some people with chronic acid reflux or chronic throat irritation have the sensation of postnasal drip that they feel is coming from above, feeling that it's coming from their sinuses, but it's actually chronic irritation of the throat that comes from below, comes from stomach acid or from chronic acid reflux. Very, very hard to make that distinction without seeing an ENT.
If you felt something get stuck in your throat on the way down, would that be an indication that it was coming from your sinuses?
Not necessarily, because you can cough up mucus and then it can drip back down, and it feels like it's going down, but it actually came from a different spot. So there are many options for it, and a good exam in the office is a good way to differentiate.
All right, thanks very much.
Yes.
If you have polyps that are untreated for a certain amount of time, can that cause vertigo symptoms?
Yeah, this is a common question actually. So just to distinguish, vertigo is dizziness, right? Or the sensation of feeling like you're spinning. Specifically in the ENT field, we have to distinguish dizziness from other forms of what we call true vertigo. And true vertigo means you feel like you're spinning or that the room is spinning around you. Now that type of dizziness is not usually caused by the sinuses. Now it could be caused by the ears. It could certainly be caused by the ears or other brain things going on. Again, very, very hard to distinguish that without having an ENT evaluation. So this is a great reason to see an ENT provider. Generalized stuffiness, sometimes a lightheaded sensation, could be caused by, say, a cold or a acute sinus infection. But what I would typically do is address those as two separate issues, and if they treat them as two separate things, if they happen to be related or one's causing the other, we get to the bottom of it. But I try to take every complaint as its own complaint and address every single issue that's affecting the patient. Yes, in the back.
What are some suggestions to prevent or control nosebleeds?
That's a great question. So how to prevent or control nosebleeds. Nosebleeds are very common this time of year. I have had probably 15 patients come in with nosebleeds over the past 2 weeks. It's common this time of year because the air is dry. It's cold outside, everyone's heat is on in the house, and it's mostly forced hot air, right? So hot, dry air that comes in through your vent with very low humidity. And what this does is it dries out the nasal cavity. Just makes the lining of the sinuses and the nose inflamed, irritated, and cracked. So just like you get dry hands or cracked or chapped skin in the winter, same thing's happening to the inside of your nose. Some good tips are try to keep your heat down in your house to as low as you can, okay, and still being comfortable, okay? 2, put a humidifier in your bedroom at night. Breathing moist air or humidified air will really help hydrate the nose. And carrying kind of like saline spray with you, spraying it multiple times a day, keeping the lining of the nasal passages moist and hydrated will really help prevent nosebleeds. Even a little trick is to put saline gel or Vaseline in the opening of the nostrils at night to kind of like humidify and moisturize that area. Now, that doesn't always work. Some people still get chronic nosebleeds or blood in their tissue when they're blowing their nose. You should not blow your nose hard, especially if you're on blood thinners like aspirin, Plavix, Coumadin, Eliquis, things like this. You will get a nosebleed and you'll end up in my office. But those are some basic tips. Yes?
With the increase of the e-cigs and the vapes, are you seeing a lot of patients complaining about nasal passage issues with that?
You know, with the common use of e-cigarettes, you know, I'm not necessarily seeing that directly causing sinus or nasal passage issues, but a lot of people that I think that I've dealt with recently do both, smoke and vape. Have cut down maybe their smoking, but have increased their vaping or something like that. So number 1, it's hard to distinguish, I think. 2, this is still a very, very active area of research. And we only have short-term data in most instances because of this new vaping phenomenon, basically, or this new lung damage phenomenon that seems to be related to vaping. So I think a lot of those questions are unanswered right now. I'm not personally seeing anything related to the nasal passages directly. Now, we know that vaping is harmful in some way because of the lung damage that's been done, especially vaping certain things that shouldn't be vaped. And number 2, vaping in general is vaporizing an oil, right? And it's depositing little oil droplets in your lungs, which no matter what's in that vape oil, you probably shouldn't be vaping because little oil particles and lipid particles don't belong in your lungs no matter what it is. At some point in a high concentration, it's not going to dissolve. Fat doesn't belong in the lungs, and you will get some form of chronic lung disease, I believe. Still an active area of research, but the thing that I am seeing is that there's still a lot of misinformation out there. People think that vaping is safe, or I don't vape what those other people vape that got sick. We don't know what's causing it necessarily. There's not enough information. But anyway, that is all yet to be determined, I think. Yes.
When I was very young, I had allergies, and I ended up going to an allergy doctor and ended up getting those shots every week for like years.
Sure.
When you get older, does that wear off, or eventually does it wear off? Because I had a couple of times when I was exposed to a lot of like dust and mold that I did get like a bad sinus thing.
Sure. And not all sinus issues are related to allergies. Of course, you can still get sinus issues even if allergies are well controlled. It can be other causes of inflammation or infection. Excuse me. But the question is, do allergy shots wear off over time? And the answer is yes, they absolutely can. Our immune systems change as we age, so what you're allergic to as a child may not be what you're allergic to as an adult, and vice versa. You may develop an allergy that you never had. That's certainly possible. And immunity in the immune system changes as we age. And allergy shots are basically a way to change the immune system. Basically, it confuses the immune system into thinking that, okay, if we give a low dose of an allergen for a long period of time, the immune system will now be less sensitive to that specific allergen. And that's the basis of allergy shots. That only works if you do allergy shots long term. So some people are doing allergy shots 3 years, 5 years, sometimes 7 years. And yes, it does need to be done weekly for a certain period of time, and then it's spaced out over time. The effect of allergy shots, even if you've done it for 3 years, 4 years, 5 years, it can wear off over time as the immune system changes and as you get further away from the allergy treatment, because the immune system forgets over time. And for those people, I recommend retesting to see if they have a big allergy component or lots of symptoms. I recommend retesting to now see if you're allergic to something else or things have changed. And they, again, maybe a candidate for allergy shots again, or sublingual under the tongue allergy therapy. If regular allergy medications over the counter or prescriptions are not working well. Yes, good question. Yes, sir.
Due to trauma, I had blocked sinus, and years later, it turned out that and you were talking about it, it actually ate through the bone, and the sinus sac when it was going into the brain cavity, and ultimately they operated
and removed it.
Left the straw in after the operation for a period of time, so that it would heal, and then took the straw out. I was in the sinus cavity.
Sure.
So when you talked about it going through the bone, I said, "Boy, been there, did that, got the T-shirt."
Yeah, that's some heavy duty stuff. But just to put on that point, the sinuses are a sensitive area because they're near important structures. They're near the brain. They're near the eyes. Anything that is affecting the sinuses and other than a regular old sinus infection, yes, can expand into those areas. Which is why if you're having any complaints or any, anything that seems like it's just not right, come in and get checked, because you want to make sure those sensitive areas aren't being affected.
You could even see in the X-ray where the lining of the sinus.
Yeah, absolutely. You're describing something called a mucocele, which is a growth of trapped mucus in the sinuses that develops after trauma. Basically, a sinus gets blocked, and not only does it cause sinus infection or a backup of mucus, but a big bubble expands in the sinuses. And while this is not aggressive, it's not like something like cancer that will eat away the bone. It will push bone, and it will push on the brain, it will push on the eye, or it can do those things, and it will expand the bone to the point where the bone becomes weak and breaks. And then, yes, the sinus passages and the nasal passages in the brain may become connected, and you may get a leak of brain fluid out of the nose, which is something that I diagnose and deal with, or you may get a double vision from restricted eye movement, or yes, that's a very good point. It's all in a very close anatomical area. Yes?
Can you comment on barometric pressure in sinuses?
Yeah, absolutely. This is a good question. So a big part of ENT medicine is something called dive medicine, which is basically dealing with people who undergo pressure changes and dealing with their medical issues. It has a lot to do with the sinuses and ears, because these are pressure sensitive areas. And you'll know what I'm talking about if you've ever been on a plane and you feel like you can't pop your ears or one ear is clogged. This is because the air pressure around you changes and the air inside your body doesn't change with it. So you get a pressure sensation or a pressure effect. To your point with barometric pressure, do you mean weather related changes?
Yes.
Yeah, so similarly, this is an area, I think, of uncertainty, and no good evidence, I think, or research supports that sinus conditions fluctuate with barometric pressure changes. For instance, you'll hear some people say, oh, my arthritis gets much worse when it gets rainy or something like that, and people will say similar complaints with the sinuses. I think on an anecdotal level, on a person-by-person basis, people do experience this. So, to my point earlier, if the sinus passages are blocked and the air passages and the sinus passages can't ventilate well, just like a blocked ear on a plane, I think you could get pressure buildup in your face, in your sinuses. It's possible. It's actually not common, but it's possible. And that can theoretically be treated the same way that we treat a sinus infection. The sinus passages can be dilated, opened up, if it doesn't get better with medicines. And if they're open, if their sinus passages are open and air can flow freely between the sinuses and the atmosphere, it's probably not a barometric pressure thing, because pressure wouldn't build up that way. But if your sinus passages are blocked, and we can see that on an endoscopic exam in the office, we can see that on a CT scan, Yeah, barometric changes, I think, I'm a personal believer in that. I think they can cause pressure. Anything else?
Okay.
Right, we're right about at 1 o'clock, so I'd like to thank everybody for coming. And if you have any further questions, I'll be in the back. Please pick up a brochure and a card in the other room if you would like to learn more. Thank you.
Say that for sure.
So clear.
Chronic.